Hello. So the purpose of this video is going to be to highlight some of the differences between one rescuer and two rescuer CPR when it comes to infants. All right. So let's talk about one rescuer CPR. All right. So how we assess the victim for an infant is a little bit different for an adult, right? So when we're checking for responsiveness, we want to tap the baby's foot. Baby, are you okay? We check for pulse on the brachial artery that's here at the bend of the elbow, and we check for respirations, right? So no pulse, no respirations, no response. We need to do CPR, all right? And so for CPR, if you're by yourself, the ratio of compressions to breaths is going to be 30 to 2. So 30 compressions to 2 breaths. All right. The technique for giving compressions when you're by yourself, you want to use your index and middle finger, and you want to press on that lower end of the breastbone. All right. And again, you're giving 30 compressions. So 1, 2, 3, 4, 5, 6, 28, 29, 30. We'll pretend that I counted to 30. And you want to use the pocket mask. All right. So making sure that you have a correct size pocket mask and you give 2 breaths. All right. Now, when you open the airway, be very careful to not overextend the infant's neck. So you want a nice neutral position and just enough air to make the little lungs rise. All right. So, and that is all you need. All right. Now, for a 2 rescuer CPR, the moment a second rescuer comes in, the second rescuer is going to show up with a bag mask device, all right? And the second rescuer, or the person that's going to be working the bag mask device, is going to be positioned at the head of the victim, all right? If you are in charge of giving compressions, all right, when we have more than one rescuer and we're doing an infant, the ratio of compressions to breaths switches from 30 to 2 to 15 to 2. All right. And also the technique of how we give compressions changes. So instead of using our index and middle finger to give those compressions, we're going to switch and use the thumbs encircling hands technique. All right. And it looks just like this. All right, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and then we give our 2 breaths. All right, so how do I remember? Well, if you're one rescuer, you're going to use one hand. All right, if you're 2 rescuers, you're going to use 2 hands. All right. And again, as a reminder, if you're the person that's giving breaths, you want to be at the head of the victim. All right, you want to make sure that you're using that EC clamp technique. All right, and open the airway and give enough breaths to make the chest rise. All right, and those are the key differences to the infant versus the adult CPR. The other thing that's slightly different is going to be the depth of compression. I almost forgot. So depth of compression for an adult is 2 inches. Depth of compression for an infant is going to be 1.5 inches. All right. All right, guys. Thank you so much for listening, and go to the next video.